There's been a lot of articles that have been shot my way on the internet lately about the benefits of doing a thrust manipulation into the thoracic spine for the purpose of eliminating neck pain. And I started thinking about that, and I can understand because a kyphotic posture will indeed put extra stress on the suboccipital muscles and the neck muscles, the upper trapezius, all those guys. I get that. But my question to this is, why does it have to be a thrust manipulation? As you know, I'm very big on muscle energy technique, and there is a wonderful muscle energy technique for those of you who don't like to manipulate or don't like the whole concept of a manipulation and the dangerous parts of a manipulation, particularly if there's osteoporosis and Marfan syndrome and all sorts of other things. That what could you do for a patient that would affect the mid-thoracics but would never place the person in jeopardy and still get a relatively permanent correction of neck pain as a result of, well, what we've referred to recently as body by Microsoft, or the problems of working with handheld information devices, computers, iPads, things of that nature. So here's what you can do. Now, regardless of what structure, could it be the substernalis? Could it be the intercostals? Might be. Could it be the anterior longitudinal ligament in the thoracic spine? Sure, why not? Could it even be the diaphragm? Heck yeah. Who knows? But what we're going to do is a contract relax for which ones of those structures is causing a kyphotic mid-thoracic or upper thoracic spine. So you basically find the part of the spine that tends to be the most rounded, and one of the things that you can do is just compress a little bit and see if you get to one that's kind of stuck. It really doesn't do well. And you can either go directly over that with the heel of your hand, or if you like the idea of going side to side like this, and what you do is you ask the patient to exhale and you follow them down, and you get to a point where you feel a good give. Now they can breathe whenever they feel like it, but what I'm going to say is don't let me push any harder. So she fights me with her breath, but we have no motion. We're having a little pushing match right now for 5, 4, 3, 2, 1, then relax, and I have her take a nice deep breath. And as she exhales, I go down even farther. So she exhales, we blow it out. Good, 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 good. There I am, even deeper. I have her breathe whenever she feels like it, but I don't let it move. And we have a little fighting match for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Release, take a deep breath. And I follow it down again. Get the tie out of the way, follow it down again, and just down, 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 go a little deeper each time. Then I say, fight me, don't let me push any harder, keep me right there. Let her breathe. She's going to be a little restricted to breathe, but that's okay. For 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. She relaxes, I relax. Have her take a nice deep breath. I don't let it move, and as she exhales, I take it down even further and further and further. And I'll do that 4 or 5 times, and have the patient get up and move around and take some nice deep breaths. Now the benefit here is I'm doing contract relax. I'm not thrusting. I'm gently stretching out those anterior structures, and I do it within the level of the patient's comfort zone. So you're stretching tissues in the front. She contracts using her diaphragm, her respiratory muscles, and then we relax and we go deeper and deeper, deeper into that reversal of that kyphosis. So play with that a little bit, and you'll notice the benefit of never having to do a manipulation. You may hear a little creaking and cracking, but it's not your goal. And then see if the patient gets as nice a response out of that. And it just may be the tool to put in your toolbox for all of this, what we call body by Microsoft, sore neck, sore shoulders, sore mid-back.